So today we've got Dr. Barbara Nicholl, and we've got Jackie Morris, who's the administrator, and Barbara is the lead for this program, the Online Primary Healthcare MSc. So I'm going to let Barbara take you through the program a little bit more. Jackie will do a wee introduction to tell you about what her role is in all this, and then we'll ask some of the questions that you'd submitted in advance. But I would say as well, there should be an option to submit questions using the Q&A function. If you're watching the webinar, please feel free to do that, and we'll have a Q&A session towards the end as well, and I'll keep an eye on that. So I think without further ado, we can get started.
That's great. Thanks, Sarah. And thank you to those. I'm sorry I can't see who has attended or numbers, but thank you for attending. And this will also be recorded for and sent out to others who are not able to attend today. I think so. So welcome, and thanks for your interest in the MSc in Primary Healthcare that we run at Glasgow. So as Sarah's already mentioned, I'm just going to tell you a little bit about kind of the learning environment and about the MSc programme. And also there's, please do feel free to ask your questions using the chat or the Q&A function that Sarah's mentioned as well. So I'm Barbara Nicholl, and I lead the MSc in Primary Healthcare here at Glasgow. I'm a senior lecturer in primary care. My particular research interests are around chronic pain, and the chronic pain alongside multimorbidity and the overlap between mental and physical health conditions. So Glasgow University is well established and a university of excellence, part of the Russell Group of universities, and this just gives you a little idea of some of the prestige, if you like, of the university. Now, the MSc in Primary Care sits within General Practice in Primary Care, which is part of the Institute of Health and Wellbeing. The Institute of Health and Wellbeing has a cluster of MSc programmes, and these are all led by academics who work across different kind of research specialities, but all with the kind of the overall aim of preventing disease or improving health and well-being and reducing inequalities, and those are both locally, nationally and globally. We hold an Athena Swan Award for equality and diversity, and we also have excellent connections with NHS, Scottish, UK governments and wider voluntary and private sectors. And this is really useful when it comes to links for our projects and so on for our research students. So why would you come and study with us and study primary care with us in Glasgow? So the main thing is to gain knowledge and skills required to really make a difference to primary care where you are. So part of what you'll study is proposing, developing and implementing sustainable strategies to address complex care needs in primary care, particularly around chronic long-term conditions. We have an interdisciplinary team of staff leading courses, and even within courses then you'll have experts leading particular weeks and particular subjects. So our lectures cover health inequalities, multimorbidity, chronic disease, treatment burden, migrant health as just some examples. And obviously we have a whole course which is dedicated to the structure, policies, strategies around actual primary care implementation and development also. And this programme meets Sustainable Health Development Goals which are set by the WHO and the UN. We always try to make sure our research our teachings is research led. So what we learn through our research or other people's research, we embed then that into our teaching so that our teaching is always as up to date as possible. And an example of that is that we will be trying to ensure that our teaching in the next semester, so in September and onwards, that we're including learning from the COVID-19 pandemic, what we're learning there and how that impacts on primary care and how primary care has had to readapt to manage the pandemic. So learning outcomes from the degree is understanding principles and values of primary care, being able to critically appraise and evidence and apply learning from that evidence into your work. This is a big thing about master's level, is really being able to critique and question evidence and other ideas and models and solutions and strategies and so on. And that's a skill that is a big part of your learning and your development through your MSc journey. We also want you to be able to develop a vision to improve primary care wherever you are, wherever that is in the world, or depending on your own professional experience or your own professional setting. Now, I've included the website link here, which I'm sure most of you have looked at before joining us, or before some of you have. My understanding is that could be a mixed group of people who maybe have already applied for the Masters, or who are interested in applying. So here you'll see our 3 core courses. So epidemiology, evidence, statistics for primary care, international primary care principles and systems, and research methods are 3 courses that you must take as part of your MSc. And then you've got the project. And I'll come on and talk a little bit more about the project at the end, but and what options are open to you for that. So that's kind of the core part of the MSc. If you just did the diploma, you could do these 3 core courses and you wouldn't go on to do your project. And for those that are interested in just taking a PG Cert, so the certificate, the core course here is International Primary Care Principles and Systems. So optional courses, we lead on a number of optional courses that are focused on primary care. If you like, and our primary care students tend to take those courses, but equally, as I mentioned, we're sit within the Institute of Health and Wellbeing, and we have a cluster of MSc programs, and you're welcome to adapt the MSc to your needs and your particular interests, and you get to do that by choosing up to 2 other optional courses from other programs that will help you establish an MSc that's most useful for you. But we still like you to take 1 optional course from the primary care selection, so cardiovascular disease management, long-term conditions, or so long-term conditions is now actually the multimorbidity and non-communicable disease is in primary care. And the other one we run is understanding evidence for the real world. So that's really learning about critiquing and applying evidence into your daily practice. So graduates from the MSc have really taken on a number of different roles. Some have stayed in where they are, but maybe developed and been able to change how they practice, or how their service provides care. Others will have gone on to get promotion through their work, or to have secondments to government. So a real variety of opportunities and that are reported back to us from our students and from our graduates. But I'm happy to talk about that with anybody if they've got any particular questions. Again, from our website, you'll have seen what our entry requirements are, so I'll just cover this briefly. We ask for a 2-1 honours degree, or the equivalent. I guess this varies across different countries. But we do also take people without a degree or with a lower degree who've got a number of years of experience related to primary care. And I think that's really important, because not everybody will have a degree, particularly if you studied earlier than, it's more in the last 10 years or so that degrees became more essential for nursing and so on. And then there's English language requirements. So do speak to us if you're concerned about whether your academic qualifications qualify you for admission. So just a bit about how we study. So obviously this is an online program. We have real-time discussion boards where we can have Q&A kind of live sessions. This is difficult when people are across different time zones, but we try to cover that as much as possible. We have wikis and blogs and different RSS feeds, journal articles. We have downloadable content is available, so you can download if your Wi-Fi or your bandwidth isn't always great, you can download and work offline and then come back and post your answers or join the discussions when you've got an opportunity to actually be online to work. And then we also have a lot of our work is kind of live seminars, or more likely to be recorded lectures, and that is so that everybody can access it at a time that's suitable for them. We really try to offer a most flexible approach to this so that you can study at a time that's convenient for you. So the MS, if you take the full MSc, it's between 2.5 and up as long as 6 years to complete. We recommend that one of our 20 credit courses takes approximately 20 hours of study per week. Obviously this varies student to student, but that is what we suggest. Each course runs over an 11-week period with 2 blocks of 5, and you've got a reading week in the middle to catch up on kind of the first 5 weeks work or to start on your assessments. The cost there I have mentioned, and just keep an eye on that because that varies, or no, it doesn't vary, but as in the most up-to-date information is on the website for that. And then obviously I've mentioned that this is online study. I just thought I know that Sarah will have a few questions for me as well, but I just thought I would run through a few things that I often get asked by students or potential students. So the reading list is, all of our material is available online, so you will have access to an online reading list, and the library makes everything available to you. So there shouldn't be any concerns there, and if there ever are issues with access, we will do our best to kind of rectify those as quickly as possible. I said I would discuss more about the project. So the types of projects that you can study are primary care based projects. That, you know, it must be related to primary care in order to be suitable to count towards your primary care degree. However, we really try to be flexible with this and supportive to students, because your expertise or your particular area of interest may not be an area of expertise of your supervisor, but that's okay, because we are here to support you, and we try to make it so that you'll have a supervisor who's got expertise in the methods that you want to use and can support you in that way. As academics, we do offer projects, but often students will come to us with a project idea that they want to do that's related to their work, and we do try to support that as much as possible. We had a question from an applicant about the timing of the project. So normal process or policy is that you would start your research project once you've completed your taught component, so your taught courses. But there can be some discussions around this, but you have to reach a certain threshold in your taught, like your assessment from your taught work, in order to progress onto your project. And that's all part of the regulations for studying with us. So it's called progression onto your research project. So types of assessments or assignments for courses, these vary across your course. But most of our primary care courses anyway, we will have 2 to 3 assessments per course. During the course time, so during that 11-week period, you might have 1 or 2 shorter assessments to submit. These might be something like designing a systematic review, or it might be you doing a lay summary, for example. So it's obviously very important, and skills around being able to describe scientific information or medical information in lay terms. So you might have to write a lay overview of a primary care model, or of for example, in cardiovascular disease management, it's around more particular cardiovascular diseases. We also try to do poster design. So there's a real variety of assessments. Your end of course assessment, which tends to be worth 50 to 60% of the final assessment for that particular course, it tends to be more of an essay-based assessment. So basically your assessment varies per course, but we do use a variety of different assessment methods, and that changes from year to year as well. Interaction online, that works through staff and students. So the interaction you get from students is sometimes as important as the interaction that you get with staff, and we try to encourage that as much as possible. And generally throughout our courses, our students are very interactive, so they want to get your feedback on their comments as much as they want to get our feedback as staff. And we do that mainly through discussion boards on Moodle. I should maybe have mentioned that our online environment is called Moodle, and that's what we use here in Glasgow. Yeah, so I think that's really all that I wanted to say. Obviously, thank you for joining us, and I hope we maybe have a few more questions, or I think Sarah has collated some questions that have come in outside of this actual Zoom. So, do you want me to stop sharing my screen, Sarah, or?
Well, maybe we could just leave that up.
Keep that up, yeah.
Because that might be useful in case anyone wants to make a note of it. So just before we jump onto the Q&A, thank you so much for that, Barbara. That was great, and I'm learning quite a lot as well, which I appreciate because I'm learning lots about all these programs that we offer. Anyway, just before we move on to the Q&A, I'd just like to ask Jackie if she wants to maybe introduce herself and talk a little bit about maybe how and why students might need to contact her and what kind of things you can help with. I appreciate it's pretty much everything, but just a tiny overview.
Yes, we'd be lost without Jackie.
Yeah, I'm Jackie Morris, and I'm one of the Deputy PGT managers, and I oversee the primary care MA Masters programme and the administration involved in that. So our team provide basically all admin support in relation to the courses on Moodle, assignments, any queries any students may have about registration, enrolment, any financial, just basically anything that's not academic is what our team does. And we're also there to help with any sort of pastoral care if anybody's encountering any difficulties. And we always respond to any communication that we get by email, because that is our prime method of contact with our online students. And you'll receive many emails and announcements from ourselves. So when you see our names coming up, whether it's myself or one of my team, then just be aware that, you know, we're trying to communicate with you about your programme. And we are aware of the time differences and different things like that, but we're always here to help you.
That's great. Thanks so much, Jackie. So we did cover some of the questions. Basically, the format we've gone for with this is when students signed up for the webinar, because as you said already, there's a lot of time difference issues. Sometimes we're aware that not everyone can make it for this time, although we tried to pick this time to make it accessible, but it's not always. So we did have some students submitting their questions via email as well, and those are the ones that I'm going to read out. But I think some of them have been covered. But one question we had was when and how will we begin to have access to Moodle? So I know you'd mentioned that Moodle is the online learning platform for this program, but do you have any more advice for students on when and how they can access it?
So Jackie will keep me right here. Be there for Jackie. So once you register as a student, which is usually in August time, you have to first register as a student with University of Glasgow, and then you enrol onto courses. Once that course opens for the year, which we have dates in September, January and April for our courses, they run, different courses run at these 3 different times of the year. It's I can't remember the date for 2020 off the top of my head for September start, but it's the 19th something. Anyway, whatever date the semester starts, that's when you will then have access to the course that you're enrolled onto. So you must enroll onto that course, and there's administrative support to kind of help you do that, but you do that through a system called My Campus. And that will, and then when the course opens in September, you would then have access to Moodle at that stage. Is that right, Jackie?
Yeah, and just to say, you've got to be fully enrolled. So not only financially, but academically, you've got to complete full registration. And then you'll get enrolled in your courses, and you'll get full access.
And the students, once, so students or applicants, I guess, who have got unconditional offers, they will get an email notification from the university when they can register. And so
registration opens on the 12th of August for all undergraduate and postgraduate, whether we're starting September or November. That's just the start date for registration, and you will receive an email telling you and directing you how to do that.
Yeah, so look out for that email. I guess what I would tell applicants, look out for that email to come through, and then you can action that. And then that's also at that stage when you'll get your official, Glasgow University email address. Isn't that right? Because just we should mention that as well. That's when Jackie talks about the importance of communication. It's through your University of Glasgow email address that we use for that.
Okay, perfect. I should also say, just before I go on to the next question, that if any of the participants wanted to submit additional ones, you can use the Q&A button at the bottom. I think it should allow you to type them up. But if you're having any issues at all, you can also email us, just email back to the email that sent you the registration. That comes through to myself and my colleague, and we'll forward your queries on to the relevant team. Another question that we had coming through, which was more generally about the online courses, but you might have a particular angle on it for your program, is about support for hard of hearing while studying online. And I wanted to mention as well that we're recording this session. We will upload it once we've sorted out the automatic subtitles, because the automatic ones tend to be interesting. So we will put this one up. Yeah, we will put this video up again as well with subtitles, but I just wondered if you had any experience of how the program can be made more accessible for people.
Yep, so the Glasgow University does have an accessibility policy to make all of our programs accessible to everyone, no matter what disability. And that's something that we're really working hard on to try and update and make sure that our program keeps to this policy and fulfills this policy. So all of our taught lectures, for example, when I say lectures, we tend to present our work in bite-sized chunks. I probably should have said that. So maybe 10-15 minutes maximum of work at a time. And so all of those works, there is a transcription and narrate alongside that. So to read through everything that we've said, if you can't follow, aren't able, are harder of hearing and aren't able to follow the speech.
Yeah.
Does that help with that one?
I think.
But if there are ever any accessibility problems, you know, we really do just let us know, and we would do our best, because this program should be accessible to all. So, yeah. And that's the same across all of our programs, and that accessibility policy is university wide. So
yeah, and it's always evolving as well. So if we need any, if there's anything missing for you, then don't hesitate to get in touch, and we'll do as much as we can to make sure that you've got the same access as everybody else. So I think the other questions were mostly covered. They were about assessment timings, which you've talked about already, Barbara, but we did have a couple of questions about any recommendations for preparing to start the course. So one student asked about any books you'd advise on purchasing, but maybe that could also be if there's any websites you would recommend checking papers on, and just generally, how can you prepare yourself for that sort of gear up to the master's level if you don't have experience of master's level study yet?
Yeah, I think that's interesting. I think so every course, as I mentioned, will have reading lists, and those will link to, even the textbooks that we offer are generally available online. So they're available online through the library, which you can't access until you are a student. So once you get your register as a university, you'll be able to access your resources for free rather than having to go out and buy textbooks. And often, to be honest, within our program, we don't use many actual textbooks because it's so research based and policy based and so on. We tend to use a lot more freely, much of which is freely available online anyway, resources around primary care strategies and policies, for example, for the core course. So I would recommend starting there. The other one, although we're hoping for a new update to this report soon, is the WHO Primary Care Now More Than Ever report, which is maybe slightly out of date now, but still applicable and still a useful document to read and look through the different core components of that report. I would say would probably be a useful one.
Okay, that sounds good. And what we'll do is I can always get the link for that from you, Barbara, and we can
of course,
we can send it out when we send out the recordings as well.
Sure, and I can have I think of some other reading as well, if that would be useful.
Perfect. So we haven't had further questions come in, so it sounds like we might have covered everything for now, but was there anything else at all that you wanted to add?
No, I guess just to say, really happy to take email queries at any point, or to have a one-to-one Zoom or Skype call with anyone if they've got any questions about applying, or about how they can fit the programme in around their work and personal life and so on. I'm more than happy to chat to any potential students. So just let us know. I've just put on the generic. Obviously, I've got my own email address, which you can find online. I've just put the generic one on here because it just means that if it's more of an admin kind of a lot like logistics type question, Jackie or one of her team will be able to respond quickly to that, and anything else they'll forward on to me and I can respond.
Yeah, perfect. Okay. Well, thank you so much for joining, or if you're watching the recording, then thank you for joining us for the recording. And as Barbara and Jackie have said, we're always here to help. The best way to get us is probably via email. You can use the primary care email, or you can just hit reply on the Zoom invitation that we sent you originally, if you're a participant, and that will come through to my team and we'll get it forwarded to Barbara and Jackie as well. So thank you so much for your time and for this overview of the programme. And we hope to welcome you soon, but if you've got anything come up in the meantime, then please don't hesitate to get in touch. So yeah,
Thank you
very much.
Okay, thank you. Bye everyone.
Bye.